Hello, I'm Dr. Deepak Bhatt, Director of Mount Sinai Heart. The Damar Hamlin case has really captured international attention. People all around the world are asking what happened. There's really been an outpouring of concern and support, even from people that don't follow the sport of football. Of course, there's no way for me to know exactly what happened with him. I wasn't involved with his care, I should say. But looking at the video clips, it really does seem like what happened was that he was hit in the chest, tackled, and then went into what's known as cardiac arrest. And there are many different causes of cardiac arrest. What seems to have happened to him, and again, this is without any knowledge of the actual details of his case, was that he suffered from what we call in medical terms commotio cordis, which is Latin for agitation of the heart, where a sudden blow to the chest can cause a cardiac arrest. Very, very rare, but that's what it looks like happened. While this is a very sad event, it certainly has created an opportunity for the public to learn about cardiac arrest. And what cardiac arrest refers to is sudden cessation of blood flow from the heart. And that means the brain isn't getting enough blood among other organs. And when the brain isn't getting enough blood, it's not happy and we lose consciousness. So that's what a cardiac arrest is, that the heart, which is a pump, isn't pumping blood, or at least not pumping sufficient blood to the brain, and people pass out, they lose consciousness. So cardiac arrest is a medical emergency. It can be life-threatening, and there are multiple causes. The most frequent cause, especially in older people, is heart attacks. It's important, though, to note that a cardiac arrest has many different causes, one of which is a heart attack, again, more common in older people. And a heart attack doesn't have to lead to cardiac arrest, though sometimes it can, which is why we always say if you're having significant chest discomfort, it might or might not be a heart attack, but the right thing to do is always call 911. Commotio cordis, which refers to the very, very rare condition of someone suffering chest trauma, usually a forceful blow delivered suddenly, can cause cardiac arrest. It's extremely rare. I have seen it before, but in general, a particular cardiologist might see one case in a career or none because of the rarity of this condition. Where it can come up is sports, such as baseball, a line drive to the pitcher's chest, that could do it, or especially before people started routinely wearing chest protective equipment, a catcher missing a pitch and getting struck in the chest. So a baseball can do it, a hockey puck can do it. Chest protective equipment really does reduce the risk, but it doesn't eliminate it. It can still happen, but obviously for especially high school sports, it's a good idea to wear appropriate protective equipment to prevent or decrease the likelihood of this complication. Also good to wear headgear to prevent a blow to the head and brain damage. So sports equipment and protective equipment can reduce the risk, but doesn't even entirely eliminate this particular risk. Beyond a baseball or a hockey puck, boxing or kickboxing or other situations where a sudden blow to the chest can cause this very rare condition of commotio cordis, and as might be the case here, even a football tackle, a helmet to the chest in the area overlying the heart might do it. But this is a very rare condition. It's really a matter of a blow striking the chest at just the wrong time, falling within a fraction of milliseconds during which the heart is vulnerable to this sort of thing. This is an extremely rare event, if indeed what happened here was commotio cordis. This is something that happens perhaps in one in several hundred million cases of a blow to the chest. And wearing athletic equipment that protects the chest can go a long way to preventing this. It can't entirely eliminate it. There are cases even where people are wearing protective equipment where it can happen. It's often in the high school athlete where this can be seen, but even there it's very, very rare. And in fact, there are more common causes, even in the young, of cardiac arrest, things like HCM or hypertrophic cardiomyopathy, a genetically enlarged heart, other sorts of genetic or congenital causes, things people are born with that can predispose to cardiac arrest at a young age, things like anomalies of the coronary arteries where the heart artery circulation is just put together wrong, or problems with the heart's electrical conduction system, things like long QT syndrome, which really just refers to abnormal electrical channels in the heart that interfere with the circuitry in the heart. So those sorts of things can predispose to cardiac arrest or sudden cardiac death. So if this is indeed commotio cordis, I must say, first of all, we don't know a ton about it because it's very rare. So again, a cardiologist may see no cases in a practice lifetime, or maybe one. So nobody has a ton of experience with this in terms of guidance to give. In general, commotio cordis is a diagnosis of exclusion. So where this is suspected, there would still be a battery of other tests to make sure there wasn't some other cause or predisposing factor to having cardiac arrest or sudden cardiac death. But if that extensive workup ends up showing nothing, then when there has been a clear blow to the chest, the diagnosis is often then assumed to be commotio cordis. So very rare, lots of tests to make sure it's not something else that's potentially going to recur or could be treated specifically. But if it turns out that it is commotio cordis, the question everyone will ask is, what's the recurrence rate? And it's hard to say. There have been case reports of recurrences of commotio cordis when someone has repeat chest trauma. But again, there's just not a lot of information, and we certainly don't have a lot of information about professional athletes who may have had commotio cordis who return to professional levels of play. So, that's a big unknown. In general, if it's a high school athlete, for example, where this happens, the advice is to avoid contact sports in the future. Obviously, for a professional athlete, that's an even bigger deal and an even bigger decision. I think a lot of parents seeing this footage are now more nervous than they might have been before about their kids being in contact sports. And let me emphasize that if this is commotio cordis, it's an extremely rare event. Think of all the tackles in football. How many people, even that are football fans that have watched professional sports for years, have seen this sort of thing? Or in boxing matches, it's extremely rare, or ice hockey or baseball. But it does happen. Younger chests are more susceptible to this, so not that it's common, but perhaps a more common presentation would be a young high school baseball player where his chest is not yet fully developed and fully muscular, that takes a line drive right to the chest in the area over the heart. That's the situation where commotio cordis can occur and where it's typically thought of. But as people get older, as they develop more chest musculature, the risk goes down a little bit. Hopefully, at least in high school and collegiate athletics, people are wearing the proper protective equipment. That reduces this risk as well if people are wearing chest protectors and that sort of thing. In the case of other sports as well, wearing head protection is important, not directly related to commotio cordis, but of course, with the uptake, say, of soccer in the US, need to be a bit careful about injuries to the head as well. So lots of different potential injuries that one can sustain in athletics. And I think that's not a reason to give up sports if you enjoy it, but certainly wearing recommended protective equipment like helmets and chest protectors are a good idea in general. But it doesn't totally eliminate the risk of things like commotio cordis. There have certainly been cases of people even wearing chest protection hit in the chest where still commotio cordis occurs. Still, important to keep everything in perspective. The risk is very, very low, and probably the risk of being physically inactive is much greater on a population level, where more people are running into trouble from being couch potatoes than from being athletic and suffering from commotio cordis, which is a 1 in several hundred million phenomenon. Cardiac arrest is one of the leading causes of death in the US and worldwide. So is heart attack. It's important to realize, though, that these are overlapping but not identical terms. That is, there are many, many causes of cardiac arrest. Heart attack is an important cause, especially in older people. In younger people, it'd be less likely, but in older people in particular, it's a very common cause of cardiac arrest. What can happen is that a heart artery gets plugged up with plaque and then blood clots, and that part of the heart doesn't get enough blood and is essentially dying. That's what a heart attack is. And in that setting, the heart electrical activity can misfire. That can lead to so-called sudden cardiac death, that is, someone just collapses, a cardiac arrest. it's a life-threatening emergency. But there are many other causes of cardiac arrest. In younger people, there can be genetic causes, things that they're born with, an enlarged heart, for example. But the key in all these circumstances is to call for emergency help immediately. So someone's got to call, in the US, 911 to get emergency medical services there as soon as possible. Now, depending on where someone might be, a rural area, a remote area, a busy traffic-laden city, it might take a little while for emergency medical services to get there, so you can't just wait for help to show up. Really, someone needs to take action. And CPR, basic resuscitative measures, is the best thing to do. So I would urge everyone to take a basic CPR course. The American Heart Association, for example, offers them, but there are other ways you can learn it too. Some are relatively quick and simple for people that can't devote the time for a full course. As well, the other important thing is to know ahead of time, before any potential cardiac arrest, where the AED, or automated external defibrillator, is in your building, whether that's your workplace, your school, in an airport, in a soccer stadium, in any number of these venues where large numbers of people might be. In general, different rules and regulations and laws require AEDs to be present. So it's useful to know ahead of time, before the emergency, where your AED is, and that device is able to determine if someone is in an abnormal heart rhythm and can then deliver a shock. So very simple to use these devices. The devices are smart devices. They will talk you through what to do, so you don't need to know anything to use one. Just have to be able to follow the very simple instructions. So the key messages are: call 911, learn ahead of time where the AED is, and learn how to do CPR. And by CPR, I really mean just chest compressions. A lot of people are grossed out by the idea of doing mouth-to-mouth on a stranger, or maybe even on someone they know. But the bottom line is just doing the chest compressions keeps blood flowing from the heart, which is a pump, to the brain, and that can keep the brain alive, because in just a couple of minutes, brain death can start to occur. All of us are potentially susceptible to a cardiac arrest. That's kind of a grim statement to make, but in fact, everyone could potentially, or anyone could potentially, have a cardiac arrest. Now, older people are much more susceptible because of heart attacks and the risk for heart attacks, which are rather common as people get older. Most people, if they live long enough, will develop coronary artery disease, and that predisposes to heart attacks. The problem with heart attacks is you can be entirely feeling great and healthy, and the first symptom of heart disease, unfortunately, can be a heart attack, so-called sudden cardiac death, where someone has a heart attack and drops dead. Now, not all heart attacks are causing cardiac arrest. That's a reason why, if anyone listening to this is having significant chest discomfort in the future, the right thing to do is always call 911. That is, don't tough it out at home. Don't decide you're going to drive yourself to the hospital. Don't ask your spouse to drive you to the hospital. All of those things are bad ideas, because if you are possibly having a heart attack, and of course you may not know unless you've had one before, but you're having significant chest discomfort, it feels pretty bad, that's not the time to drive, because if you have a cardiac arrest, which can occur as a consequence of a heart attack, you don't want to be behind the wheel, because you could kill yourself and other people on the road. And if your spouse is driving, well, hopefully then your spouse won't kill other people. But if you have that cardiac arrest, you're sitting upright, you're in a car, very hard for emergency medical services to find you and get to you, and probably the resuscitative effort won't be successful, and brain death is very likely. So the right thing to do is always call 911. There's no emergency department where if you do that, they're going to say, oh, why did you call 911? Everyone that's of a medical background thinks that if there's substantial chest discomfort, calling 911 is always the right thing to do. What might have happened here, this commotio cordis, is a very rare event, so really I don't think people need to worry about it so much, other than wearing appropriate protective equipment during competitive sports, in particular contact sports. I think the bigger message really to get out there is people should be physically active. Physical inactivity gets a lot more people in trouble than it does playing sports. But having said that, I think there's a lot we can do to protect our heart health. Again, this isn't specific to preventing commotio cordis, but just trying to prevent the other things that cause heart attacks or cardiac arrests, or both. And it all comes down to a healthy lifestyle. So it starts with good diet. And the best diet really is a plant-based diet, high in fresh fruit, vegetable, and whole grain intake. That's the best diet. So the more of that that's in your diet, the better off you're going to be in terms of reducing the risk of cardiovascular disease, also the risk of cancer and other diseases like diabetes. And trying to reduce or avoid red meat is a good idea. I think beyond the diet, daily physical activity is good, formal exercise if possible, but if not, just even things like brisk walking are better than nothing, and trying to do at least 30 minutes of vigorous physical activity. By that I mean something that basically works up the sweat is a really good idea. So diet, some degree of vigorous physical activity, whether formal exercise or not. And then there are other things too that help, not just cardiovascular health, but health in general. Getting a good night's sleep. I know that's not always easy to do, but that's extremely important. Watching one's weight. It's a natural tendency as we get older to put on weight, but even an extra 10 pounds can increase the risk of things like high cholesterol and high blood pressure and diabetes, and all those things increase the risk of heart disease. So it's really the simple stuff, but in real life it's not always so simple, but trying to focus on diet, exercise, sleep, and weight control, and of course not smoking or vaping are really the best things someone can do to try to protect their heart. Really the best things to do to improve heart health are to try to maintain a good diet. By that I would endorse a plant-based diet. It doesn't have to be vegetarian or vegan. It can be, but it doesn't have to be. But a plant-based diet really refers to a diet that is high in intake of fresh fruit, fresh vegetables, and whole grains. So the larger the percentage of the diet that is consisting of those things I mentioned, the better off you are for reducing the risk of heart disease, heart attacks, strokes, cancer, diabetes. So it's just a good way to have a healthy, balanced diet. Red meat, better to avoid it if you can, but if you can't, at least limit the quantities. Beyond a diet, daily exercise is important, at least 30 minutes. But for people that don't really like to exercise, I'm just really talking about vigorous physical activity. It can be 30 minutes of brisk walking, ideally something where you work up a sweat. So it can be things you enjoy doing, even just gardening. But again, it all depends on the pace of doing things. It really, I think, is key to work up a sweat. Otherwise, you haven't really worked out. But any physical activity is better than none. So even if it's just a matter of parking your car further from the store or your office and walking a bit more, or taking the stairs instead of the elevator, those little doses of exercise can add up over a lifetime. Beyond diet and exercise, maintaining a good weight is important. The natural tendency is to put on weight, but even an extra 5 or 10 pounds can increase the risk of diabetes, high blood pressure, high cholesterol, which in turn increase the risk of heart disease and other medical problems. And sleep, very important. I know hard to get a good night's sleep these days. Everyone's got a busy, chaotic lifestyle, it seems, but trying to get a good night's sleep is really important. It helps maintain a normal weight. It's also just good in terms of mental stress and for a variety of different reasons. And the final thing I'll mention is not smoking or stopping smoking if you do smoke. Really, that raises the risk of heart disease and cancer probably more than any other one vice. Beyond just saying don't smoke or stop smoking, I'll include vaping, which is really catching on among young people. That also appears to be bad for cardiac health. And while one can debate which is worse, smoking, vaping, both are worse than doing neither. So don't take up vaping if you are young and not already doing it. And if you are doing it, I'd say stop. And for people smoking, same advice. And by smoking, I mean cigarettes, cigars, all of the above. Likewise, I'll throw in their marijuana. That counts as smoking as well. I know a lot of people aren't going to be happy about that, but the reality is that also raises the risk of cardiovascular disease. So basically a good clean lifestyle goes a long way in terms of reducing the risk of heart disease, and as it turns out as a bonus, also reduces the risk of things like diabetes and cancer. So I guess I would just say in closing that this tragic situation really has provided an opportunity for, I'd say, the entire world to focus a bit more on heart health. And even though potentially what happened here, commotio cordis, is a very, very rare event, a greater awareness of cardiac arrest and the many things that can cause a cardiac arrest, including things like a heart attack, including things like congenital conditions in younger people, I think this greater awareness will hopefully help people lead healthier lifestyles and prevent heart disease.